Hello, my name is Laszlo Karai. I'm the Program Director of the Surgical Critical Care Fellowship at OHSU. I'd like to welcome you to the application process. I prepared this video to provide you some important information about the fellowship ahead of your interview. And so as an overview of our program, our fellowship is divided into 6-week rotations. So in your curriculum, you will spend 6 months of your fellowship on the trauma surgical ICU service. You will spend 6 weeks on the Portland VA surgical ICU service. For the remainder of your time, you'll spend it on 3 6-week electives with some flexibility. We must adhere to program requirements, which state that 10 months of your year must be dedicated to the care of ICU patients. Here's a sample schedule of a fellow. And so you notice the 6 months are spent on the trauma surgical ICU. However, with the electives available, this fellow has chosen to divide their elective time into such electives such as palliative care, ECMO, echocardiography, cardiovascular ICU, a pre-hospital elective, and the neuro surgical ICU. OHSU has robust facilities, all contained on Markham Hill, which is the site of our main campus. And so the Portland VA, the OHSU main hospital, the Shriners Hospital, and the Children's Hospital are all on campus, connected by various routes and sky bridges. Relatively new on campus is the Portland Aerial Tram. This tram connects our main campus to the South Waterfront campus, which includes outpatient and outpatient operative facilities, simulation center, as well as the medical school. There is also opportunities for living, including apartments and condos that former trainees have taken advantage of during their year of fellowship. And so just as a grand overview of our trauma care, so our trauma bays are in our emergency room, and so the elevators would take patients from either a helicopter, or if they were going to the operating room, they would go down 2 floors. Otherwise, trauma patients would go to a CAT scanner and on our same floor ICU. The fellows' offices are currently on the same floor of this complex, which allows you to easily access your office, as well as to go back to patient care when necessary. In our emergency department, we participate in multi-professional care. So we handle emergency activations with the emergency room and anesthesia staff. So for modified activations, the ER staff and resident, trauma nurses, and the trauma chief resident are there. For full activations, we add a respiratory therapist, attending trauma surgeon, and attending anesthesiologist. Our ICU has been recently redesigned for more spacious rooms. And so we can have the ability to perform somewhat complex procedures in our ICUs. We have a central resuscitation bay with overhead lights, which allows us to perform laparotomies if necessary in the ICU. For our home rotation, the trauma surgical ICU, we divide that into weekday and weekend rotations for coverage. On the weekday portion of your year, you will spend Thursday nights acting as the trauma chief, providing surgical coverage during the day and night for 24 hours. You will also cover the trauma chief during certain vacation weeks. These opportunities are important as they provide an operative experience and allow you to integrate within the trauma team. The trauma surgical ICU weekday rotation has you provide daytime coverage on Monday and Tuesday, Wednesday with continuity. And again, Thursday you become the trauma chief and then spend a 24-hour rotation in-house. And then Friday morning you would sign out. And then you have the weekend off before returning on Monday. For the weekend rotation, it's essentially the opposite, with you providing continuity in the ICU from Thursday to Sunday. Wednesday, you will act as a flex role where you may provide some clinical coverage if needed, and also it will allow you to focus on education efforts. The trauma surgical ICU team is multidisciplinary. A typical team consists of an attending physician, a fellow, 1 to 3 advanced practice providers, 1 to 2 residents, and 1 to 2 interns, as well as medical students. We do utilize a multi-professional staff to try to provide optimal patient care. And so on a typical daily basis, you'll be interacting with nurses, pharmacists who are actually on rounds, social workers, case management, physical therapists, physiatrists, and the dietitian team. We have structured this fellowship to allow flexibility, and this allows you to focus on clinical endeavors, but also equally important educational and personal development efforts. The schedule allows fellow coverage, so we can flex and cover each other, so you can attend meetings, you can attend interviews with great flexibility. The Wednesday backup fellow, as I mentioned, allows a focus on team ICU education. I want to go through some of the elective choices. Echocardiography is typically a several week rotation focusing on just performance and interpretation of echocardiograms, which is very helpful at the bedside in the ICU. We have a pre-hospital EMS rotation that allows you to do some ride-alongs and attend trauma system meetings. We have our cardiovascular surgical ICU, which takes care of our more complex cardiac and thoracic and vascular patients. Our ECMO rotation involves a multidisciplinary group providing ECMO care throughout the hospital. And then we also have popular pediatric ICU and medical ICU rotations. We do offer the ATLS course in the event that you've lapsed your coverage. If you're not an instructor already, we do offer an instructor course, and so you have an opportunity to be certified with an instructor during your year of fellowship if you're not yet certified. Starting in 2022, we started offering the Definitive Surgical Trauma Care course, and so this is offered to fellows annually. It's one of the first deployments of this course in the nation, and it's a course that focuses on trauma surgery and the decision making, and it's done through group discussions, an operative course with the animal lab, and then an exposure course with a cadaver lab. There's a focus on multi-professional communication, and again, by taking this course, you have an opportunity to become an instructor in the DSTC program. We do fund you for travel to a national meeting during the year. Some fellows have inquired about taking a course in lieu of travel to a meeting, and we are flexible with that arrangement as well. We do offer a robust faculty from different backgrounds. The big advantage to fellows is that with our current faculty, there is almost always a niche of professional development, mentorship, and sponsorship in nearly every field, any field that you would be interested in. OHSU participates in the AMC TTT program, which is a military-civilian partnership. And so a team of multi-professional Army personnel deploys at OHSU, including 1 to 2 trauma surgeons, a trauma nurse, ICU nurse, and a CRNA. The trauma surgeons in this program serve as surgical critical care faculty. This has been a welcome benefit to the fellowship as it adds multiple new faculty members with different perspectives and experience, which has been a boon to fellowship education. Our trauma research program has obtained over $30 million of funding in the past 15 years. The Trauma Lab has weekly research meetings that the fellows are invited to. And with these meetings, you can discuss and develop projects, obtain resources, participate in ongoing studies, and then practice presentations for meetings you'll be invited to. There is a host of educational opportunities that are just built into our program in the fellowship. There are weekly multidisciplinary critical care lectures offered by the various ICU groups at OHSU. There's a Wednesday morning weekly trauma conference with interesting cases. And then there's a Friday morning journal club we term Trauma Breakfast, where fellows select articles that are presented by students and residents. Now, the fellows lead the discussion, but the attendings also comment on their relevance to the clinical setting. And this allows a self-guided mastery of the literature. The VA does have weekly meetings as well in terms of education conferences. And then we've dedicated a monthly attending fellow conference to provide education at a exclusively fellow level. In terms of a baseline curriculum for self-guided learning, we do subscribe to the SCORE curriculum, and so you'll have access to the SCORE curriculum as well as the testing resources. There are also numerous administrative opportunities for you as a fellow, and so we do have you participate in both the Wednesday weekly division M&M as well as a monthly ICU M&M. There's a trauma committee where we get to focus on program improvement and implementing new quality efforts. We have a peer review meeting as well that'll be part of your fellowship. And then you'll have the opportunity to participate in various quality improvement committees and then regional trauma advisory boards, which lets you focus on trauma at a system level. We do ask that you complete a QI project. Typically, these are something that come up as a clinical need, and then they are presented for approval at the trauma committee level. And so it typically involves the evidence-based clarification of a guideline or a procedure. This always has the opportunity for scholarship if you look at outcomes and implementation. We also have the fellows participate in an end-of-year fellow debate, which is a two-on-two format focusing on a current controversy in acute care surgery. We have had a successful track record of graduating fellows, and so I'm just going to go through some of the recent years here. All in all, on the graduates that I demonstrated, the breakdown is about 48% go into academic careers, 45% go into private practice, and 7% continue on their military careers. Some changes that we have had recently is that we've been refocusing our evaluation system to provide more timely, frequent feedback. We have been experimenting with an ICU triage rotation where you serve as a resource throughout the hospital to look at ICU transfers, perform procedures with a fair degree of autonomy, which has been popular. And then on Mondays, we do offer you some acute care surgery coverage to expand your operative opportunities. We've also been expanding our conferences with a trauma radiology conference, focusing on interesting cases from both a trauma perspective and a radiologic finding perspective. And then we've been altering our lecture schedule to make sure that more fellows can attend. And so all these changes are geared towards gradual improvement and a benefit to your educational experience here. Oregon is a great place to live. I've been here for over 2 decades now, but there's always really cool things to find in the city and in nature. There's no lack of cultural events to attend, and so it is a great place for you to spend time during your fellowship. And so to summarize, this is a highly flexible program. It does have a robust research environment that will give you many opportunities. There's a lot of high resources available for you to practice optimal clinical care. And also it's a very busy clinical environment in both complex surgical patients and trauma patients. And we have an excellent placement history and track record for our graduating fellows. I will have an opportunity to answer any questions during your interview day, so don't hesitate to write some down. But I can't look forward to meeting you, and I hope to see you soon. Thank you.